February is National Heart Month. Here with some tips to help keep your heart in tip-top shape is cardiologist Dr. Carlos Zamora. Dr. Zamora, good to have you.
Thank you for having me.
Welcome to our show.
Thank you.
All right, so it's February, it's National Heart Month, and I actually did not know this. This surprised me. Heart disease is the #1 killer in the U.S. 1 in 4 U.S. deaths each year are from heart disease. I mean, I knew it was a big problem, obviously, but it's a really big problem.
Unfortunately, you're not the only one that didn't know that it's the first cause of death in the U.S. And that's the main problem here. We need more awareness about heart disease and how it strikes every minute in the whole country.
Yeah, and when we talk heart disease, we're not just talking heart attacks. That's only a part of it, right?
Yeah, that's an important point, that we're talking about heart attacks and unstable angina, they call it, when you have chest pain that can lead to heart attack in the future. We're talking about stroke.
Right, so let's talk about preventative, so you don't have to end up in your office or on a table or something like that. What are some things that people watching right now need to start doing immediately regarding their heart?
So the key here is what you just said, that many people think that prevention is, they're not thinking about going to the office, like you just said, so they don't have to go to the cath lab or to your office. Actually, you have to come to the office
right.
So we can do the prevention. And to an office of somebody that is going to look into your risk factors. The risk factors are the keys for prevention here. And we have to really make sure that we identify them early on, treat them accordingly, you can make a follow-up plan because things change. And that's where it gets tricky here, because you may have one risk factor today, but next year, if you don't show up again for a follow-up visit, you may have developed the new risk factors. You got to make sure that you have your lipids, which is your cholesterol, the fatty cells circulating in your body. You have a healthy level of cholesterol, healthy level of sugar in your bloodstream, and as well as the blood pressure. Those are the main ones that can be measured in the office, but you also want to make sure that you're doing the right amount of exercise, which is aerobic exercise, tends to be much less than what people think you need. Research has shown that 30 minutes of vigorous, intense activity every day is already good enough, building up to 45 minutes on a daily basis of any aerobic exercise. Most of the studies is just walking, which is free, very easy to do, and readily available for everybody.
Yeah. Okay, the Mount Sinai Sports Cardiology program, there aren't many of these around, I would imagine, right?
Yeah, I believe we are the only one in Florida. Very few of us that are doing this in the country.
So how does it work specifically? So a patient comes in to you and they say, I want to start running marathons, or I want to weight train or whatever, but I have a leaky aorta, whatever.
Right.
So what's the process? What do you do?
Very good history of what has been done in the past and what kind of exercise you have done in the past. Okay. Family history is very important here to make sure that there's nothing that is undiagnosed. And with a good EKG, which is an electrocardiogram, very easy done in the office, we pay attention to slight, very hints of possible heart disease in those guys that are younger. And the folks that are 35 and above, the #1 usually is that we're talking about the #1 cause of death, which is usually heart attack or strokes, and that we're going to be focusing the evaluation towards that.
Do you recommend, we're running out of time here, but let's say someone has a parent someone has a child who's a teen, and they're going to start playing football or whatever, and they think their kid is fine, no evidence of any heart disease, but as a child or a teenager is about to start progressing through athletics, should they come see you? Should they get a sports workup?
Yes, I actually have a very good intent of bringing more awareness for kids, because the #1 cause of death on them, especially when they're exercising, is called hypertrophic cardiomyopathy, which we are a center in Mount Sinai. They take care of that type of diagnosis, occurs in 1 in 500 kids, and there are about 50 to 70 kids in the U.S. that dies every year playing sports because of this disease.
Dr. Zamora, thanks so much for coming by.
Thank you.
People have questions if they want to see you. How do they do it?
Well, they go to our website, msmc.com, or they can call to 305-674-CARE.
Good to see you. Take care.
Thank you.
You got it.